Christine Vitovic. I'm the Planetary Health Lead at our Osher Center, and I want to welcome you to this Family Medicine Grand Rounds, which is being offered as a part of the Laura Mann Integrative Healthcare Lecture Series. Laura Mann was a compassionate home birth nurse midwife who dedicated her life to caring for her patients with love and empathy. After being diagnosed with stage 4 breast cancer, Laura embraced a whole health approach and learned to thrive despite her diagnosis. A visionary in every sense, her journey inspired her to establish the first local center focused on the benefits of integrative healthcare. In 2015, the Laura Mann Center merged with the University of Vermont, and today we honor Laura's legacy through this endowed lecture series. Through my role as Planetary Health Lead at the Osher Center, you've heard me say before that integrative health is a pathway to planetary health. In this vein, I am absolutely thrilled to introduce to you Dr. Jonathan Patz, who is visiting UVM through the Gund Institute's mechanism as a Macmillan Visiting Scholar. He's going to spend the next few weeks with us, and I invite you to come and get to know Dr. Patz while he is here. He's absolutely a treasure in many ways. He has received many accolades, and there are way too many for me to list here because I would be standing here for way too long. But a few things I just want to point out to you to help you understand why did we bring him here. So he's come to us from the University of Wisconsin, where he is a Vilas Distinguished Achievement Professor and the John P. Holton Chair of Health and the Environment. He holds appointments in both the Nelson Institute for Environmental Studies and the School of Medicine and Public Health Department of Population Health Sciences. He served as the inaugural director of Wisconsin's Global Health Institute. He currently directs the Planetary Health Scholars Program and is the director and PI of a new NIH Climate Change and Health Research Center, which focuses on community-driven health-first climate action. He's also very renowned nationally and internationally. He was the health co-chair for the first US National Climate Assessment, a lead author for the UN Intergovernmental Panel on Climate Change, the IPCC, and that was the organization that won the 2007 Nobel Peace Prize. In 2019, Jonathan was elected into the US National Academy of Medicine for his pioneering research on climate change and health. And recently, he spent the spring of this past year, 2024, on sabbatical at Monash University in Melbourne, Australia, in the School of Public Health and Prevention, Division of Planetary Health, where he now also holds an adjunct professorship. I am very excited to have Jonathan here because I think he's really another indication of the importance of planetary health merging with the health sciences. And we look forward to having you here with us for the next few weeks. Thank you so much, Dr. Patz.
Thank you, Christine. Thank you. So I'm just wondering, can you hear me online through this microphone? Good? Okay, great. Wonderful. I just want to say Christine is one of our superstar PhD graduates from Wisconsin, really a leader in sustainability and some very innovative work, and including looking at chemicals in the water, drugs in the water, green burials, and other things that are really more important than many of us realize. But so I am honored to be here, and thanks to Christine for having a Gund Macmillan Scholars Award, and to be here with you, and thanks for the invitation for the Grand Rounds. I'm going to be talking about the role of medicine and healthcare in this new emerging area called planetary health. And I want to start with the United Nations declaration that we are in the midst of a triple planetary crisis. This is what the UN talks about when they talk about climate change, biodiversity loss, and pollution. These are three big overarching problems. The National Academy of Medicine has placed climate change as a very top priority. The National Academy rarely puts out a grand challenge, but they have a grand challenge on climate change, human health, and equity that's happening right now. And many of you already know about the health effects of climate change. This is a pretty new study, a prospective study, epidemiologic study looking at outdoor workers. And this was in India. They followed 800 women laborers and found that heat exposure doubled the risk of miscarriage. And heat also increased the risk of any adverse pregnancy outcome. We also have issues with more wildfires and the smoke from wildfires. This study, it was in the journal Pediatrics, found that PM, fine particulates, PM 2.5, from wildfire smoke is very harmful, more harmful than other sources of wildfire smoke, other sources of PM 2.5. And going back to prenatal care, that wildfire smoke and most air pollution also affects birth outcomes. So we know that these exposure pathways from climatic extremes are harming us. In the area of infectious disease and also other pathological diseases, these are not all infectious, but most of them are infectious diseases. More than half of human pathogens are affected by extreme climate factors. This systematic review found more than 1,000 pathways through which climate extremes affect human pathogens. Vector-borne diseases, waterborne, airborne, direct contact, like with poison ivy, foodborne diseases. So that's a lot of pathways through which climate can affect us. And some of the most sensitive diseases are carried by cold-blooded insects, because whatever the air temperature is, that's the body temperature of this cold-blooded mosquito. And Aedes aegypti carries yellow fever, dengue fever, and Zika virus. So it's a major source of arboviruses around the world. Dengue fever is the most prominent, most prevalent vector-borne disease, vector-borne arbovirus. And when we think about climatic disruption, what's one thing that we experience every 4 to 5 years? So the residents, every 4 or 5 years, abnormal climate conditions driven by what phenomenon that in Spanish means baby? El Nino, right. So during El Nino of the winter of 2015, that's one of the strongest El Nino events we've seen in recent history. And we constructed a 60-year average temperature during that El Nino. And Brazil and Colombia were more than 2 standard deviations above an average temperature. It was bloody hot during this El Nino. Well, during that El Nino, Zika erupted, and that period of time had the highest vectorial capacity in the last 60 years, the highest vectorial capacity for that mosquito to transmit disease, because it's a temperature-driven relationship. And in the laboratory, it turns out that Zika virus optimal is 29 degrees centigrade. That's 5 degrees warmer than dengue fever. I had been telling people, look, it's the same virus family as dengue. Zika is also carried by the exact same mosquito. Whatever climatic conditions affect transmission of this mosquito carrying these diseases, it's going to be the same as dengue fever. And there was a raging dengue epidemic in South America at the same time that Zika erupted. But I didn't know about these I learned later that these lab studies came out showing that it's possible, though, that extremely hot El Nino could have been a spark that really allowed Zika to take off. Now, of course, temperature is not everything, and every infectious disease is very complicated. With Zika virus, there was a international travel component. There were some outbreaks in some island nations, and either canoe racing or the World Cup, somehow the virus was brought to South America, South and Central America. But just like when West Nile virus hit New York City for the first time, the fact that the temperatures back then were the hottest July ever recorded in the United States, in New York when West Nile came in, it came in from international travel, but did that extreme temperature allow it to take off? And so we wonder about Zika virus. We don't know the answer, but did that extremely hot condition during that record-breaking El Nino have something to do with Zika just erupting? Now, of course, when we talk about planetary health, climate change is a really big deal. I've dedicated my career to climate change pretty much, but also land use change. It's not just about disrupting the Earth's climate. We are changing the landscape of the world in a very in a dramatic way. This is the fishbone pattern of deforestation in the Amazon. You view from satellite, you can see these logging roads. And we asked the question about malaria risk because there was a mosquito that, Anopheles darlingi mosquito, had not been in the Amazon for, it was not there for until, I don't know the year, but it was introduced probably in the 80s or 90s. I know from colleagues at Hopkins that were looking for Anopheles darlingi mosquito. It was not there until later on. And so we were wondering, why was malaria taking off? And why was that mosquito there? And it hadn't been there before. And so we looked at areas of deforestation, and we controlled for human population because more people, more parasite, more malaria, right? So a lot of the places we looked at that were deforested were abandoned agricultural sites, so we can control for human population. And my student, Amy Vitor, did this field study looking at the biting rates of the bad actor mosquito, which is Anopheles darlingi. And also her team dipped for mosquito larvae and basically found much higher biting rates, more mosquito larvae in deforested areas. And for every 1% of deforestation, the incident rate of malaria was 11% higher. So here's a direct relationship of landscape degradation, deforestation, leading to the risk of infectious disease. Another problem with deforestation comes with bat-borne viruses. That's Dr. Raina Plowright, who's now at Cornell University. She made the discovery of Hendra virus, the outbreaks of Hendra virus in Australia, linked back to deforestation. And that deforestation in Borneo and Indonesia partly drove these bats to look for other food sources, and a combination of deforestation and also shocks with El Nino, where forests do not have a winter bloom for feeding the bats. This combination of extreme climate and deforestation were the main drivers of Hendra virus outbreaks in Australia. There are some studies that indicate that SARS, CoV-2, COVID virus, there were some very extreme climatic conditions, and that migratory routes were changed throughout East Asia. I've only seen one paper about that, so the jury is out on the influence of climate extremes or land use change with COVID. But this is a really amazing, if you're interested in ecological determinants of diseases, this bat-borne Hendra virus is really a great teaching example of a direct link between deforestation, extreme climate, and disease emergence. And the third part of the triple planetary crisis is pollution. And we've heard a lot about the microplastics. In this diagram, you can see that plastic waste is the tip of the iceberg when you think about all the other problems with pollution. So that's, the triple planetary crisis. And I want you to all memorize this table here. No, I don't really, but in your spare time, come back to this diagram. But I just want you to, right now, just ask one question, and that is, do we focus enough on the early ecological determinants of disease for effective prevention? So this is where, when we think about doing a good job of preventive medicine and family medicine, to me, my first medical boards are family medicine and then occupational environmental medicine. So family medicine to me is, prevention, prevention, prevention. We are not doing a great job at looking far upstream at these ecological and climatic determinants. And therefore, without doing that, we are not doing a complete job. And this is where planetary health comes in. In 2015, the Rockefeller Foundation and the Lancet put out this commission report on planetary health. And according to this report, planetary health is rooted in understanding the interdependencies of human and natural systems. And several papers define planetary boundaries. So there are 9 boundaries within which humanity can continue to develop and thrive. In other words, vital signs of the planet. So what are these 9 planetary boundaries? You can see them displayed here. And many of these are very obvious, as far as what they would mean for health. Certainly, the stratospheric ozone depletion and risk of skin cancer. That, by the way, is a huge success story of international negotiations to ban CFCs. And now the ozone hole is recovered, and we're within this green circle. If we can stay within this area where natural resources can regenerate and be sustained, that's the whole point, is to stay within that green circle. So that's fine with the ozone now. But you can see these other ones. This is nitrogen from farming and freshwater. I've given examples of climate change, and I gave an example of land use change. But all of these are defining how we can sustain our health and well-being. And we want to stay within that green circle. This obviously, genetic biodiversity, these are species going extinct, that never come back. So you get into the red zone and you get into irreversible changes that you can't get back. And last year, they updated the boundaries and found that we are out of bounds for 6 of the 9 planetary boundaries. So this is sort of crisis mode. We really can't afford to wait any longer to embrace this linkage between the environment and our health and to really get on with it. There are major centers now around the world. This is the biggest US center, the Institute for Planetary Health at Johns Hopkins. This was the one that started up at Harvard, but it just moved to Hopkins about 2 years ago, directed by Sam Meyer. And there are almost 500 universities, organizations, and government entities that have programs in planetary health across 79 or more countries. And the Planetary Health Alliance, which is run out of the Hopkins Planetary Health Institute, they coordinate this alliance. University of Wisconsin, we're one of the founding members of this alliance. So Wisconsin is part of the alliance. And there are huge resources here, huge teaching resources offered up in this group. Planetary health is a rapidly growing transdisciplinary field. This is from that institute, quoting, focused on understanding and addressing the human health impacts of our degradation of Earth's natural systems. It's also a social movement that calls for deep systematic change centering on social justice and intergenerational equity. So when you think about planetary health and what needs to be taught, there are some core principles. I showed you some of these case studies, but among the core principles, in the middle is the interconnection with nature, understanding that our health really depends on nature and intact ecosystems. Recognizing that humans are in fact disrupting the Earth's natural system. So, building in the idea that of the Anthropocene, humans affecting the Earth. Equity and social justice are core to planetary health. It's movement building and system change and system thinking. So you should be working with engineers that do full life cycle assessment. When someone asks, should we buy an electric car? Well, it depends where your electricity comes from. Do full life cycle assessment, system thinking. A couple months ago, we came out with a paper integrating planetary health into medical education and gave some examples. This is just one table. It's an example of a rare bacterial disease, melioidosis, which is a disease that I really don't know about. But my Australian colleagues, when I was down on sabbatical, they work on this. And, you can see in this table thinking about the principles, anthropogenic, the Anthropocene, systems thinking, equity, and across climate change, land use change, globalization, and then coming up with aligning things relevant to that disease as they cut across those areas, those concepts. So there are materials out there to help design courses and case studies in planetary health. Coming back to the National Academy of Medicine and their grand challenge on climate change, there's also a pillar. There's one on greening the hospital, the healthcare sector, getting to a low carbon healthcare sector. There's another action collaborative of the National Academy called Roadmap for Transformative Change to Achieve Health and Equity at Net Zero Emissions. And the goal here is to say, yes, we want to prepare and we want to green hospitals, but we want to recognize that it takes all the sectors. Our health depends on transportation, energy, food systems, right? So, taking a systems approach, but also if we take a systems approach to, a planetary health systems approach to this issue, there are major health benefits, immediate health benefits that could be enormous. So this is just a sort of framework on climate change. Burning greenhouse gases, releasing them into the atmosphere that causes climate change. And you all should know about the health impacts across heat waves, vector-borne diseases, waterborne diseases, nutrition, forced migration, mental health, all these ways that climate affects our health. And then we can intervene either here to reduce the exposure and build resilience. That's called adaptation. Or we can intervene here and reduce the emissions. Now, in preventive medicine, I would call this primary prevention, and this is secondary prevention. So we have strategies for building resilience, And we need, we're already seeing climate change. So we do need to build resilience and reduce the risk from the exposures. But, you can't keep cleaning up the mess on the floor without thinking about turning off the faucet, right? So we need to go upstream and do both at the same time. And we need to build, we need to recognize that people don't understand this, and we need to improve our communication and build movements, and also, do a lot better job of communicating this. This framework, this is how we've designed the second edition of our textbook, Climate Change and Public Health. And I'm circling this primary prevention part because if you look at this hopeful image on the bottom, a third to half of our textbook is about opportunity. Getting to low carbon offers enormous opportunity, especially thinking about energy policy, transportation policy, and agricultural policy. For example, oh, by the way, here's a secret for you. If you go to Oxford Press and have your library buy this, subscribe to the book for the price of 2 books per year, the entire UVM campus has a book. So that's the way to do it. Don't tell Oxford I told you that. No, actually, they don't mind. They like that. So here's this is from the London School of Hygiene and Tropical Medicine. They have a Pathfinder initiative funded by the Wellcome Trust, looking at all these different sectors. So this is agriculture, forestry, and other land use sectors. Power generation, industry, buildings, clean cook stoves, transportation. You can see if you decarbonize across those sectors, how you can improve air quality, diet, physical activity, and lead to major health benefits. And I want to show you, put some numbers, some examples, just 3 sectors. The energy sector, air pollution, we all know air pollution is terrible. It kills up to 8 million people every year. Of the 8 million premature deaths, more than 5 million are directly attributed to burning fossil fuels. This is a paper in the British Medical Journal. It came out last year. In the food sector, we all know about healthy diet, right? And if we were to, this is the Lancet Commission report, Willett from Harvard. And anyway, if the world followed the universal healthy reference diet, which is mostly the Mediterranean diet, that would prevent 11 million premature deaths. And if we were to have cities designed for people instead of just for automobiles, you'd increase physical activity. And if you add those numbers up, well, 8 million for all of air pollution, 11 million, 4 million, that's almost half of all premature deaths. I mean, it's huge. It's a huge opportunity to get to, a low carbon economy and have health benefits. In our group, one of my PhD students, Nick Mayu, looked at decarbonizing across the United States. What would it mean for fine particulate air pollution? And the headlines are that if we were to decarbonize, that would save 50,000 lives every year, and more than $600 billion in avoided mortality and health costs. This is the map of benefits. The darker the blue, the more the benefits. You can see the Ohio River Valley, where we still have some coal-fired power plants, sees the biggest benefit. But transportation now is the largest greenhouse gas emitter in our country because we are getting rid of coal. So transportation is really big, but this is, health benefits. Now I saw that there's some arguments that we have to hang on to fossil fuels, because it costs too much to go to green energy. And what about all those poor people that are not going to be able to afford energy? We need coal and oil. Well, since 2019, that's a lot of bull. And I would not go with that story at one bit. Look at the price of solar. It's dropped 300-fold in the last 40 years. And for the first time ever, getting electricity, renewables and batteries are the cheapest way to generate electricity. So any argument that says we need to stay with fossil fuels is a false argument. And I've been in meetings with conservative Republicans who are totally in favor of solar energy because they say, we are about free market. We don't want any government subsidies. And now they say, well, free market, renewables are the way to go. That was not true 5 or 6 years ago. So there is no economic argument for fossil fuels. Quickly shifting gears to the food sector, I'll just show a couple things. This is that report that I mentioned, Walter Willett et al., Food in the Anthropocene, looking at healthy, sustainable diets. And I'll just show one figure, which is that thinking about the universal healthy reference diet, which is, it's a diet we all know pretty much, that we shouldn't be eating anything to the right of that dotted line. So way too much red meat, starchy vegetables. So if we were to eliminate that and get to a healthy reference diet, we're talking about 11 million premature deaths that would be avoided, and enormous environmental footprint avoided with high meat diets and deforestation for clearing, for ranching and things like that. So this is a big, big deal as far as getting healthy and protecting the environment at the same time. And finally, transportation sector. In the United States, the cities with the highest rates of walking and cycling for commuting to work have lower obesity rates and lower diabetes rates. And if you think about contracting muscles, you talk to the medical physiologists, contracting muscles are chemical factories for anti-cardiovascular disease, anti-cancer disease. So you reduce heart disease, cancer, dementia, and depression. We all know how fantastic exercise is. So it's time that we design that for, people that can routinely have exercise. Design it. This is, I was in Australia last year for sabbatical. This is pictured from Brisbane, Australia. We really need to design cities for safe alternative transportation, not over-reliance on private motorized vehicles. And finally, with land use change, this is a paper from the Proceedings of the National Academy of Sciences that showed that there's an inverse relationship between developing a psychiatric disorder in your lifetime and the childhood exposure to green space. So the more green space that you have growing up, whether or not you live in a rural area, a small town, or even in the capital cities, the amount of green space protects you from having mental health problems through the lifetime. So another golden opportunity to bring back green space. So medical and health practitioners have a huge role to play. The communication scientists say that doctors and nurses are the most trusted messengers when it comes to almost anything. And so they trust scientists. I think regarding climate change, they trust scientists by about like in the 80s, low 80s or something percentage. They trust doctors. 90% of people trust doctors. 92% of people trust nurses. And so doctors and nurses are really important spokespeople for this issue. And so, having trained and educated health practitioners involved is super important for communicating to the public and getting policy to move. And this is just for climate change, which is one of the 3 problems of the triple planetary crisis. But there are lots of groups coming on board. There's the Medical Society Consortium on Climate and Health. The AMA is part of that. The AAP is part of that. I think there are 20 some medical specialties that are part of the Medical Society Consortium on Climate and Health. Soon to probably change their name following our Healthy Climate Wisconsin. I think it's going to become Healthy Climate America, but for the moment it's called Medical Society Consortium on Climate and Health. Medical students are on board for Sustainable Future, MS4SF. And this is, I think the slide is now it's pretty old now. Wow, it's very old. So I don't know what the number is, but back in 2018, we had 5 million health professionals and 17,000 hospitals and research centers on board. So there are lots of hospital CEOs that are very interested in greening their hospitals, and they take this quite seriously. So I would want to just conclude by saying that considering the broad health implications of today's triple planetary crisis, a systems-based planetary health education is needed to better prepare our medical and health practitioners. So with that, I thank you for your attention, and I'm open for questions.
Yeah, I'm gonna, ooh. I've been monitoring the chat, and so there's just a couple of things here. One was there was a little trouble with the screen share, but it was okay. So we'll let that go. And then actually both of these were about our screen share and our audio. I'm not sure what was going on with that. But for anyone who is on Zoom, just remember this has been recorded and will be able to be accessed through the Osher Center website soon, and you'll be able to watch it and with all the audio visual more easily. So we apologize for that. I'm not sure what we did with our screen setup earlier, but you will be able to see the whole thing because the slides were very, very powerful. Any questions here in the room?
Thank you very much, Dr. Patz. I wonder if you could touch base a little bit about, or maybe create an idealized curriculum for the health sciences for folks in colleges of medicine and nursing, about what that might look like in terms of really moving the work upstream. Just if you could encapsulate some of your thoughts, I'm sure are extensive.
Yeah. So they can hear that online, right? Yeah. Okay. There are many ways to approach it. I think the first thing to do is to try to integrate it into a lot of things that are happening through the medical curriculum, so that it's not an add-on, like we teach this, this, and this. Oh, and now we got to teach climate change, land use change. I think it's really important. What we're doing in Wisconsin is we're building it across the curriculum. So there are several hours that are required in the first year and first year in the medical curriculum, but there are also elective courses. We're developing modules now, so there are a few case studies that go into different modules, be it digestive system, physiology, nervous system, whatever you're teaching. There are now modules that you can, build in some climate change and land use change issues. But at the same time, we have courses. We have a climate change in medicine. It's called a medical selective. And so 4th year students take that when they are, looking for residency, and it's based around their schedule. It's 2 weeks, 2 credits in 2 weeks, high powered, condensed thing. We have graduate courses, Planetary Health and Climate Change is a graduate course. In our undergraduate school, there's one of our largest majors is global health. And the required first course when they go in there is called Our Planet, Our Health. So they get fully indoctrinated into the idea that it's about systems and multiple sectors and not just to over focus so narrowly, in the beginning. So that's something. But in the medical school, we have the required hours. We have a couple of the elective courses, and now we're developing more modules to get in there. So I think, everyone has a full plate. And so the idea is, don't give me a serving of something new. Show me how climate change and planetary health affects everything else I'm working on. That would be my recommendation. And take advantage of the resources, especially the Institute for Planetary Health at Hopkins. They have a whole bank of materials and lectures, and there's another thing like that. Stanford University and your alma mater, University of Washington, now have a clearinghouse of teaching material for planetary health. So those are two areas. Columbia University has a medical education center on climate change. So there are a couple of, hot spots you could just in an instant have plenty of material. And of course you can have my book for nothing, Yeah.
Well, there are a lot of questions pouring into the chat now. So if maybe we clear a couple of these. You talked very well there about curriculum. There were a couple of questions about that, but the next one was, what are the most accessible resources we as nurses and doctors can use to educate ourselves more on this topic, to be able to speak to it to our patients and make change?
Yeah, I think, so one thing right away, the Medical Society Consortium on Climate and Health, that's nurses and doctors. And so there are resources there, and I would say get plugged into that. Get plugged into their nursing students that are working in planetary health. The University of Minnesota has a big program out of their nursing school. In fact, the University of Minnesota Planetary Health is led by the nursing school. Wisconsin, our nursing school has Jessica LeClaire dedicated to planetary health. And then some of the resources I just mentioned, the Institute of Planetary Health at Hopkins, the Columbia University Center for Medical Education, Climate Change and Medical Education, and then Stanford and UWash. Those are some direct places to go right away for resources, I think.
And bring up we have an in-person question.
By the way, I will just say one more thing. The NIH did have this new these P20 centers for climate change and health research. So there are now P20 centers, NIH P20 centers that could become a resource. They are for research mostly, but just keep that in mind. Okay, sorry.
Oh, no problem. Thank you for your presentation. I'm Gary Atwood. I'm the interim director of Dana Library. I wanted to follow up on your slide about nurses and other health professionals and their trusted status sort of in our community. Was wondering if you had any thoughts about how that may or may not have been impacted by our recent experience with COVID and sort of the undermining of certain health professionals related to a controversial topic.
So I have to confess that I have been asked that question before. And it's a really good question, and it's a tough question. I can't pretend to say that it didn't have a hugely negative impact. I mean, all I can say is that when we're grappling with global environmental change, that I think there's much more common ground when you talk about health than when you talk about environment. I think the COVID pandemic and the politics around it have been pretty discouraging. And I think we just need to continue to be honest. And I don't have the answer to how to best restore trust, other than to just keep going and communicating honestly and become better listeners. I know with vaccine deniers, there's real resistance, and there are studies that show that if a person actually starts to believe to not believe it, to understand the science and to say, you know what, vaccines are really good, and what I've been doing is not good for my child, that the defense mechanisms of self-esteem jump up and say, well, I can't accept it. There are all sorts of barriers. And I would say that
whatever you
well,
want. There's integrated within the system different things, then you can.
Hey, Aaron.
yeah. So I'd say that with climate change, we think that there are a lot of climate deniers. They're not. If you poll the communication scientists that have polled the United States, they do it's called the 6 Americas survey, attitudes on climate change. 70% of the US population is either concerned or very concerned about climate change. But, it's a few very loud people, climate deniers that are out there. And you just, you're not going to move them. But 70% of the population, that's a lot of people to talk to. And there's a famous climate scientist and evangelical Christian, Catherine Hayhoe, who says, we just talk about it, just keep talking about it, and don't pretend that, you're going to insult somebody, or what if I hit a climate denier or something. Just keep talking about it. But again, we all have to be better listeners. We have to understand, where are people coming from? Why do they feel a certain way? Find the common ground, something that, yes, at least we agree we want to keep our children healthy. So let's start there. Find the common ground and be a better listener. That's just common sense that I would say we have to work harder on that.
There are some more questions here. There's a couple about population, the effects of our global population, and the controversial conversation around population control, and just also kind of thinking about folks looking at population change, including stable population, aging, how that might interact with the factors you talked about, the 3 main pillars impacting our planetary health.
Sure. Thank you. Another great question. I'll start with that last part, which is, in an aging population, those most vulnerable in heat waves are the elderly, because the skin is the largest organ in the body, and the way we cool ourselves is, cardiac. You pump the blood to the skin, and you have evaporative cooling. Anyone that has cardiovascular compromise, or maybe on diuretics and risk of dehydration, elderly are more at risk in heat waves. Also, elderly don't sense the heat as much. They don't know when they're hot. So that's a higher risk in heat waves. The question about population, the root cause of all of this, it's 2 things. It's population growth, human population growth, and per person consumption, per capita consumption of resources. I've had this question before, and we have had a much better job. We've made better gains at stabilizing population growth than we have in curbing per person emissions. So I would say that, family planning is having, we're doing that much better. Our populations are probably going to stabilize around 10 or 11 billion. But we're not doing well with reducing emissions. You know, we have more and more efficiency, and yet our greenhouse gas emissions keep going up and up. If you look at a graph of air pollution and GDP, well, we're doing really well. You know, our GDP keeps going up, and because of the Clean Air Act, you know, our air pollution, you know, we've improved in the United States. Our air pollution has gone down and down while our GDP goes up and up. But that's not true for greenhouse gas emissions that are not like conventional air pollutants. You know, CO2, methane, nitrogen oxides. These are, you know, they are continuing to climb. So where I think we've had great gains in population control and in family planning, we are just not doing well with the speed at which we need to reduce our greenhouse gas emissions.
Thank you. There were a couple of just people dropping some resources into the chat. So if anyone is looking at that online, that one is from Beth Zigmund saying that another resource for med professionals is Home, My Green Doctor. Diane Emery mentions, and she's our network director of sustainability, that anyone with the UVM Health Network email, you can access something called Practice Green Health. It's a membership only resource, but you can use it by using the member number 166239. That's from Diane Emery. So we'll try to keep that, maybe send it around.
Can I add to that list? There's a
Yes.
great podcast called Climate Clinic. That's a really good one. There's also, for any of you that want to follow climate change, Outrage and Optimism. About that's more about the climate politics and stuff. But Climate Clinic is a good app for clinicians.
Dr. Patz, in our last couple of minutes here, I'm curious. I've had the great fortune of having worked with you for many years now, and I'm always inspired by your optimism and your hope. And I love that you continue to lead with the idea of if we make changes to help mitigate climate and to adapt to climate, we have this potential outpouring of better health, and that this is an opportunity, as you've told us many times. I'm curious if you can kind of help us conclude here with some of the things that, where do you find hope and optimism? What is it that keeps you in that headspace that we can lean on as well?
Right. No, Christine, I'm glad you asked that question because in my typical public lecture, this is a design lecture for you guys, but in my regular public lectures, I try to have a balance of about 30 to 35%. Wow, this is serious, and oh my God, you got to pay attention. And 65 to 70%. This is the greatest health opportunity of our lifetime. When you think about, you know, air pollution, diet, transportation, and physical fitness, that, you know, to climate actions, you know, what we would do to reduce the threat of climate change would not only have the long-term benefit of reducing the risk, but would have immediate health benefits that are huge. I mean, really huge. You know, 20 million premature lives every year. You know, so that's a big deal. I also think that you're seeing at the local level, you know, there are many things happening in small towns, and it was great when I saw in West Virginia that the coal mining museum has solar panels on its roof, and that there are these in Texas, there are mayors that are moving forward saying, hey, we see renewable energy is a way to go. While still there is still the problem of vested interest, just like tobacco industry, the fossil fuel industry has taken up the same communication tactics, in fact, the same communicators. So there's definitely a lot, you know, there is a bit of a villain in the room. And so to the extent that it's now cheaper to use renewables. That's brand new. That's a good story. And that, the opportunities, we don't have to wait for the solution. We do need to counteract the disinformation, the intentional disinformation by fossil fuel industry. That we do have, that's something that's a tough fight, and we have to fight that fight. But the opportunities are huge when you think about getting off of fossil fuels and how and using health as the lens to say, okay, forget the world, forget the polar bears, forget stabilizing the climate. We want health for our kids tomorrow. Design cities for safe biking and walking, have clean energy, eat the right food, less, get rid of the concentrated animal feeding operations and have less meat in the diet. These are like tomorrow. It offers health benefits.
Thank you so much. And Whitney, would you like to say anything to conclude? Or
Well, just thank you so much for being here today. We do not have any more questions in the chat. I really appreciate how you spoke to curriculum in the medical schools. And I feel like between these issues and the thing that I'm passionate about is our diet, our nutrition, education for medical students. I feel like there are ways that we can bake these things in little bite-sized pieces to meet both new requirements for education, but already into existing curriculum without having to create all new curriculums. That we could maybe do this in a nicer, easier, smooth way that would make sense when you're talking about cardiovascular systems. Talk about, red meat and how that would improve our planet. Simultaneously, things like that could be done pretty smoothly. But thank you.
Right. Thank you.
See you later.